Question 1. A confused elderly patient with a history of falls is admitted after a minor head injury. Which immediate nursing action most reduces the risk of another fall? A. Place the patient on a bed alarm and leave the bed in low position. B. Apply soft restraints to prevent ambulation. C. Instruct the patient to call for assistance every time. D. Assign a sitter and keep the bed rails up on both sides. Answer. A. Place the patient on a bed alarm and leave the bed in low position. Rationale. Step 1 assessment. The patient is confused and at high fall risk. Step 2 intervention. A bed alarm alerts staff promptly when the patient attempts to get up, allowing safe assistance. Keeping the bed low reduces injury if a fall occurs. Why be incorrect? Soft restraints increase harm and are not first line for fall prevention and require legal or ethical justification. Why C incorrect? Relying solely on patient or family compliance is unsafe for confused patients who may not call. Why D incorrect? A sitter is useful but not always available. Full rails on both sides can cause entrapment or increase fall risk if the patient climbs over. Best practice is alarm plus environmental modifications plus supervision. Question 2. A nurse is about to administer oral amoxicillin to a patient with a documented penicillin allergy, rash. What is the safest next step? A. Administer the medication and monitor for rash. B. Withhold the medication and notify the prescriber. C. Give a lower dose to decrease allergic reaction risk. D. Substitute with a different antibiotic from the same class. Answer. B. Withhold the medication and notify the prescriber. Rationale. Step 1. Recognize contraindication. Documented penicillin allergy increases risk of reaction. Step 2. Safety action. Withhold medication and contact prescriber to clarify orders and request alternative. Why A incorrect? Administering despite allergy risks an adverse reaction. Why C incorrect? Dose reduction does not eliminate allergy risk. Why D incorrect? Substituting within same class without prescriber order risks cross-reactivity. Nurse must consult prescriber or pharmacy. Question 3. A patient with a Foley catheter shows cloudy urine and low-grade fever. Which immediate nursing action best follows infection prevention principles? A. Clamp the catheter for 2 hours then reopen. B. Remove the catheter as soon as possible if no longer indicated. C. Irrigate the catheter with sterile saline. D. Change the catheter bag every shift. Answer. B. Remove the catheter as soon as possible if no longer indicated. Rationale. Step 1. Identify risk. Indwelling catheters are a major infection source. Step 2. Best prevention. Remove unnecessary catheters promptly to reduce CAUTI risk. Why A incorrect? Clamping can promote urinary stasis and infection. Why C incorrect? Routine irrigation is not recommended and risks introducing organisms. Why D incorrect? Frequent routine bag changes aren't necessary and can increase contamination. Change when indicated, soiled, or damaged. Remove catheter and notify provider for evaluation or treatment. Question 4. A nurse receives 2 medication vials that look similar. One is insulin and one is heparin. What is the best immediate safety action before administration? A. Check the patient's last blood glucose and give insulin if high. B. Label each vial and confirm with another licensed nurse. C. Administer a small test dose to observe effects. D. Choose the vial with a clearer solution. Answer. B. Label each vial and confirm with another licensed nurse. Rationale. Step 1. Prevent wrong drug error. Similar appearance is a look-alike risk. Step 2. Safety step. Label vials immediately and use independent double check by a second licensed nurse for high-risk meds, insulin, heparin. Why A incorrect? Checking glucose alone doesn't prevent wrong drug administration. Why C incorrect? Test dosing is dangerous and not appropriate. Why D incorrect? Visual clarity is unreliable and unsafe. Use labeling plus double check. Question 5. A patient on continuous heparin infusion shows a sudden drop in platelet count. Which is the priority action by the nurse? A. Stop the heparin infusion and notify the prescriber. B. Decrease the infusion rate by half. C. Continue infusion and draw platelet count again in 24 hours. D. Increase monitoring frequency to hourly. Answer. A. Stop the heparin infusion and notify the prescriber. Rationale. Step 1. Recognize potential heparin-induced thrombocytopenia, HIT. Step 2. Immediate safety. Stop heparin to prevent thrombosis. Notify prescriber for alternative anticoagulation and further workup. Why B incorrect? Decreasing rate still exposes patient to risk. Why C incorrect? Waiting delays necessary action. Why D incorrect? Monitoring alone does not mitigate harm. Prompt cessation and reporting is required. Question 6. A nurse enters a patient room and the IV pump alarm is sounding. The patient is stable. What should the nurse do first? A. Silence the alarm and continue current task. B. Immediately unplug the pump to stop the alarm. C. Assess the patient and the IV site and pump function. D. Remove the IV and start a new one. Answer. C. Assess the patient and the IV site and pump function. Rationale. Step 1. Prioritize patient. Always assess patient safety first, patency, infiltration, signs of distress. Step 2. Troubleshoot pump. Check tubing, occlusion, fluid level, and settings. Why A incorrect? Silencing without assessment may mask a critical issue. Why B incorrect? Unplugging pump halts therapy and may be unsafe. Why D incorrect? Removing IV without assessment could interrupt necessary therapy. Take action based on findings. Question 7. A nurse observes a colleague administering a higher than prescribed opioid dose. What is the nurse's ethical and professional responsibility? A. Ignore it to avoid conflict. B. Document the event privately without reporting. C. Intervene immediately to stop the administration and report. D. Ask the colleague later if it was intentional. Answer. C. Intervene immediately to stop the administration and report. Rationale. Step 1. Immediate safety. Prevent patient harm by stopping wrong dose administration. Step 2. Accountability. Report per facility policy to ensure investigation and patient protection. Why A incorrect? Ignoring jeopardizes patient safety and violates duty. Why B incorrect? Documentation alone without reporting fails to stop harm. Why D incorrect? Delay risks patient safety. Immediate intervention is required. Question 8. A postoperative patient is ordered to ambulate with assistance, but refuses because of pain. What should the nurse do to promote safe mobility? A. Force the patient to ambulate to prevent complications. B. Provide analgesic, wait for effect, then assist ambulation. C. Cancel ambulation orders and document refusal. D. Tell the patient ambulation is mandatory and non-negotiable. Answer. B. Provide analgesic, wait for effect, then assist ambulation. Rationale. Step 1. Assess pain and barrier to cooperation. Step 2. Treat pain to enable safe ambulation. Then assist and use gait belt or assistive devices. Why A incorrect? Forcing increases risk for injury and violates autonomy. Why C incorrect? Canceling may delay recovery. Better to address barrier. Why D incorrect? Coercion undermines patient-centered care. Address pain, then safely mobilize. Question 9. A nurse notices that hand hygiene sinks are empty of soap in a busy ward. What is the best action to maintain infection control? A. Continue care and use gloves instead. B. Report the supply shortage and bring soap to the area. C. Use alcohol-based sanitizer only for all tasks. D. Ask patients to remind staff to wash hands. Answer. B. Report the supply shortage and bring soap to the area. Rationale. Step 1. Immediate mitigation. Provide needed supplies, soap, to maintain hand hygiene options. Step 2. System correction. Report to ensure ongoing supply. Why A incorrect? Gloves are not a substitute for hand hygiene. Why C incorrect? Alcohol sanitizer is appropriate for many tasks, but not for visibly soiled hands or certain pathogens. Both soap and sanitizer availability is ideal. Why D. Incorrect. Patients should not be the primary safety monitors. Staff responsibility is required. Question 10. A newly graduated nurse will delegate vital signs to a nursing assistant for a stable patient. Which instruction ensures safe delegation? A. Take vitals whenever you have time. B. If the patient's BP is systolic less than 90, notify me immediately. C. You don't need to record the oxygen saturation. D. Don't bother me with routine findings. Answer B. If the patient's BP is systolic less than 90, notify me immediately. Rationale. Step 1. Safe delegation requires clear instructions, expected findings, and thresholds for reporting. Step 2. Providing a specific abnormal parameter guides the assistant to escalate appropriately. Why A. Incorrect. Vague timing leads to missed assessments. Why C. Incorrect. Omitting important data is unsafe. Why D. Incorrect. Discouraging communication undermines safety and protocol. Question 11. A patient is placed in airborne isolation for suspected tuberculosis. Which PPE in practice is most appropriate for the nurse when entering the room? A. Standard precautions only. B. Surgical mask and gloves. C. N95 respirator, fit tested, and negative pressure room. D. Gown and face shield only. Answer. C. N95 respirator, fit tested, and negative pressure room. Rationale. Step 1. Recognize transmission. Airborne pathogens require respiratory protection. Step 2. Follow guidelines. Use a fit-tested N95 respirator and ensure patient is in a negative pressure room. Why A. Incorrect. Standard precautions are insufficient. Why B. Incorrect. Surgical masks do not provide adequate filtration for airborne particles. Why D. Incorrect. Gown or face shield protect against droplets or splashes, but not inhalation of airborne organisms. Question 12. During medication reconciliation, a nurse finds 2 anticoagulants listed, warfarin and a new direct oral anticoagulant. What should the nurse do first? A. Administer both as ordered to avoid misdose. B. Hold both and consult the prescriber for clarification. C. Give only warfarin because it's long-standing. D. Ask the patient which one they usually take. Answer. B. Hold both and consult the prescriber for clarification. Rationale. Step 1. Recognize potential duplication and high-risk interaction. Step 2. Safety. Hold until prescriber clarifies to avoid overdose or bleeding. Why A. Incorrect. Administering both risk serious bleeding. Why C. Incorrect. Assuming preference without clarification is unsafe. Why D. Incorrect. Patient may not know drug interactions. Provider clarification is required. Question 13. Which action best promotes a culture of safety after a medication error occurs? A. Punish the nurse who made the error to deter future mistakes. B. Complete an incident report and participate in a root cause analysis. C. Discuss the error only with peers informally. D. Ignore the event if no harm occurred. Answer. B. Complete an incident report and participate in a root cause analysis. Rationale. Step 1. Reporting. Documenting via incident report provides data. Step 2. Learning. Root cause analysis identifies system fixes to prevent recurrence. Why A. Incorrect. Punitive actions discourage reporting and worsen safety culture. Why C. Incorrect. Informal discussion alone lacks documentation and system learning. Why D. Incorrect. Ignoring near misses misses opportunity to improve systems. Question 14. A patient requires transfer from bed to stretcher. Which action best prevents musculoskeletal injury to the nurse and patient? A. Ask one staff member to help and lift quickly. B. Use a mechanical lift and at least 2 trained staff. C. Slide the patient without using a transfer device. D. Bend for the waist and use arm strength to lift. Answer. B. Use a mechanical lift and at least 2 trained staff. Rationale. Step 1. Assess patient transfer needs, weight mobility. Step 2. Use mechanical lifts and trained personnel to protect both patient and staff per safe patient handling policies. Why A incorrect? One helper is often insufficient for safety. Why C incorrect? Sliding without device risks skin shear and injury. Why D incorrect? Improper body mechanics risk staff injury. Always use equipment and team. Question 15. A nurse is preparing to administer a PRN sedative to an agitated patient. Before giving it, which safety check is essential? A. Ask the patient if they want the medication. B. Verify the last time the sedative was given and current level of consciousness. C. Increase the dose if agitation seems severe. D. Administer and then document the time given. Answer. B. Verify the last time the sedative was given and current level of consciousness. Rationale. Step 1. Confirm timing. Check last dose to avoid overdose. Step 2. Assess sedation risk. Evaluate consciousness, respiratory status, and vital signs before administration. Why A incorrect? Patient consent is important but doesn't replace safety checks. Why C incorrect? Arbitrary dose increase risks respiratory depression. Why D incorrect? Documentation after administration is required, but initial safety checks must come first. Question 16. While performing central line dressing change, a nurse's sterile field is contaminated. What is the correct immediate response? A. Continue and finish quickly to reduce time. B. Stop, discard contaminated supplies, perform hand hygiene, and reestablish a sterile field. C. Cover the site with a sterile gauze and finish. D. Ask another nurse to hold instruments while you continue. Answer. B. Stop, discard contaminated supplies, perform hand hygiene, and reestablish a sterile field. Rationale. Step 1. Prevent infection. Contamination risks CLABSI. Step 2. Correct step. Stop, reglove hand hygiene, and rebuild a sterile field before proceeding. Why A incorrect? Continuing risks infection. Why C incorrect? Temporary cover is inadequate. Why D incorrect? Delegation cannot salvage a contaminated sterile procedure. Field must be reestablished. Question 17. A patient-controlled analgesia, PCA, pump is set with a bolus allowed every 10 minutes. The patient reports improved pain but shallow respirations. What should the nurse do first? A. Increase the lockout interval to 20 minutes. B. Stop the PCA and stimulate the patient. Assess respiratory status. C. Give naloxone immediately without assessment. D. Decrease the basal rate only. Answer. B. Stop the PCA and stimulate the patient. Assess respiratory status. Rationale. Step 1. Immediate safety. Respiratory depression is life-threatening. Step 2. Action. Stop PCA to prevent further opioid delivery. Stimulate, assess RR, O2 sat, and call for help. Prepare naloxone if needed. Why A incorrect? Changing programming requires prescriber or order and cannot be done as the first immediate action. Why C incorrect? Naloxone may be needed but must be based on assessment and ordered or per protocol. Initial action is stop and assess. Why D incorrect? Decreasing basal rate may be insufficient as boluses may still cause depression. Question 18. A patient wristband is faded and cannot be read. Before administering any medication, what should the nurse do? A. Administer medication because the provider ordered it. B. Ask the patient to state their name and DOB and proceed. C. Replace the wristband with a new one and verify identity per policy. D. Use the chart to verify identity and ignore the band. Answer. C. Replace the wristband with a new one and verify identity per policy. Rationale. Step 1. Reliable ID. A legible wristband is a primary identifier. Step 2. Action. Reband the patient and verify using 2 identifiers per facility policy before meds. Why A incorrect? Orders do not override identity verification. Why B incorrect? Patient verbalization is used but should be corroborated with wristband and chart. Some patients may be confused. Why D incorrect? Chart alone is insufficient. Wristband is bedside identifier. Question 19. An inexperienced LPN asks to administer a high-risk medication. What should the RN do to ensure safe delegation? A. Allow it because the LPN is licensed. B. Delegate and instruct the LPN to call if concerned. C. Verify the LPN's competency, provide specific instructions, and remain available for supervision. D. Refuse to delegate and do it all personally without explanation. Answer. C. Verify the LPN's competency, provide specific instructions, and remain available for supervision. Rationale. Step 1. Delegation principles. The RN must assess the delegatee's competency for the specific task. Step 2. Provide clear instructions, limits, and supervision plan. Why A. Incorrect. Licensure alone does not confirm competence for a high-risk task. Why B. Incorrect. Vague instruction risks, unsafe practice. Why D. Incorrect. Refusing without explanation misses opportunity to build competency and doesn't follow delegation standards. Choose safe delegation based on assessment. Question 20. A nurse discovers a near-miss medication error that caused no harm. What action best supports system learning? A. File no report since no harm occurred. B. Report the near-miss through the facility's reporting system and participate in safety review. C. Discuss the near-miss only with the peer involved. D. Change the medication label alone to prevent recurrence. Answer. B. Report the near-miss through the facility's reporting system and participate in safety review. Rationale. Step 1. Recognize value. Near misses reveal system vulnerabilities. Step 2. Action. Reporting allows root cause analysis and system improvements to prevent future harm. Why A. Incorrect. Not reporting loses learning opportunities. Why C. Incorrect. Informal discussion lacks documentation and system-level follow-through. Why D. Incorrect. Individual fixes, label change, may help, but system review ensures sustainable solutions. Question 21. A nurse discovers a patient attempting to get out of bed without assistance despite a known fall risk. What is the priority intervention to ensure safety? A. Re-educate the patient on calling for help. B. Activate the bed alarm and keep the bed in the lowest position. C. Raise all side rails. D. Request a physical therapy consult immediately. Answer. B. Activate the bed alarm and keep the bed in the lowest position. Rationale. Bed alarms alert staff immediately, and a low bed reduces injury. Education alone, A, is not enough for high-risk patients. Raising all rails, C, may be considered a restraint. PTD is helpful, but not the priority. Question 22. Before administering digoxin, the nurse notes the patient has an unreadable wristband. What action promotes patient safety? A. Ask the family to identify the patient. B. Proceed since the nurse knows the patient by face. C. Replace the wristband and verify 2 identifiers before administering. D. Skip the dose until pharmacy verifies identity. Answer. C. Replace the wristband and verify 2 identifiers before administering. Rationale. Unsafe identifiers require replacement to prevent wrong patient errors. Recognizing by face, B, is unsafe. Family identification, A, is unreliable. Skipping the dose, D, still requires proper ID. Question 23. While preparing to administer IV potassium, the nurse notes the solution is cloudy. What is the safest action? A. Shake the bag to dissolve sediment. B. Administer it slowly. C. Discard and obtain a new IV bag. D. Call the provider for permission to administer. Answer. C. Discard and obtain a new IV bag. Rationale. Cloudiness indicates contamination or improper preparation. Never shake, A. Slowing the rate, B, does not fix contamination. Provider permission, D, is not appropriate. Do not administer unsafe fluids. Question 24. A nurse is caring for a patient on contact precautions. Which action is appropriate before leaving the room? A. Remove gloves before removing gown. B. Remove gown first, then gloves, then perform hand hygiene. C. Exit with PPE and remove it in the hallway. D. Reuse the gown for other contact isolation patients. Answer. B. Remove gown first, then gloves, then hand hygiene. Rationale. Correct doffing reduces contamination risk. Removing gloves first, A, is incorrect sequence. PPE must not leave the room, C. Gowns are single-use only, D. Question 25. A nurse finds the crash cart unlocked on a busy unit. What is the correct safety action? A. Lock it and report immediately. B. Ignore it if fully stocked. C. Remove medications but keep equipment available. D. Place a sign stating do not use. Answer. A. Lock it and report immediately. Rationale. Unlocked crash carts jeopardize emergency readiness and medication security. Ignoring B and partial modifications, CD, do not meet safety standards. Question 26. During bedside shift report, the nurse notices the infusion pump running at double the prescribed rate. What is the priority action? A. Document the finding after reporting. B. Stop the pump, assess the patient, adjust to the correct rate. C. Continue at current rate until report is complete. D. Call pharmacy to verify rate. Answer. B. Stop the pump, assess the patient, adjust to the correct rate. Rationale. Incorrect infusion rates can harm the patient. Correct immediately. Documentation, A, is done afterward. Waiting, C, is unsafe. Pharmacy, D, does not determine pump rates. Question 27. A nurse is assigned 4 patients. Which task can safely be delegated to a UAP? A. Administering oral medications. B. Assessing a new postoperative wound. C. Assisting with ambulation using a gait belt. D. Interpreting vital signs. Answer. C. Assisting with ambulation using a gait belt. Rationale. UAP can assist with basic mobility. Medication administration, A, and assessment, B, are RN duties. Interpretation of vitals, D, is clinical judgment. Question 28. A patient reports dizziness after standing. Which action prevents further injury? A. Encourage patient to walk it off. B. Assist the patient back to bed slowly. C. Leave patient standing to see if dizziness resolves. D. Give water immediately. Answer. B. Assist the patient back to bed slowly. Rationale. Orthostatic symptoms require safe guided return to seated or lying position. Walking, A, increases fall risk. Leaving them standing, C, is dangerous. Water, D, does not address immediate risk. Question 29. A nurse preparing medication identifies a decimal error, 10 milligrams instead of 1 milligram. What should the nurse do first? A. Call the provider to clarify. B. Administer the smaller safe dose. C. Ask another nurse what to do. D. Change the prescription independently. Answer. A. Call the provider to clarify. Rationale. Clarification prevents overdose. Independent change, D, is illegal. Administering, B, without clarification is unsafe. Consulting another nurse, C, does not replace provider clarification. Question 30. A nurse performing a central line flush notices the syringe meets resistance. What is the safest action? A. Apply more pressure. B. Stop and assess for occlusion or kinking. C. Remove the central line immediately. D. Flush with tap water. Answer. B. Stop and assess for occlusion or kinking. Rationale. Forcing flush can cause catheter rupture or embolus. Removing the line, C, is not within RN scope without order. Tap water, D, is never used in invasive procedures. Question 31. A medication label is partially torn, making the dose unreadable. What should the nurse do? A. Estimate the dose based on usual ranges. B. Discard the medication and obtain a replacement. C. Ask another nurse to guess the correct dose. D. Administer half to avoid overdose. Answer. B. Discard the medication and obtain a replacement. Rationale. Unreadable labels must not be used. Estimating, A, C, or guessing half, D, risks error. Question 32. A nurse is about to give an IV antibiotic when the patient says, I've never taken this before, what is it for? What is the safest response? A. Tell the patient not to worry. B. Explain the medication and purpose before administering. C. Delay until the provider arrives during rounds. D. Ask a family member to explain it. Answer. B. Explain the medication and purpose before administering. Rationale. Patient education and informed consent are safety standards. Minimizing concerns. A. Undermines safety. Waiting. C. Delays therapy. Family. D. Cannot replace nurse's duty. Question 33. During a fire alarm, a bedridden patient is on oxygen. What should the nurse do first? A. Turn off the oxygen supply. B. Remove patient from danger. C. Extinguish visible flames. D. Close all unit doors. Answer. B. Remove patient from danger. Rationale. Race protocol. Rescue alarm contain extinguish. Removing patient is first priority. Turning off oxygen. A. Is helpful, but secondary to rescue. Question 34. A nurse sees a UAP attempting to transfer a heavy patient alone. What is the safest RN action? A. Allow the UAP to finish. B. Tell the UAP to stop and get mechanical lift assistance. C. Report the UAP to administration. D. Take over and complete transfer alone. Answer. B. Tell the UAP to stop and get mechanical lift assistance. Rationale. Safe handling requires proper assistance and devices. Allowing A or doing it alone D risks injury. Reporting C may be needed later but not the priority. Question 35. A nurse preparing to administer morphine notes the respiratory rate is 8 per minute. What is the priority? A. Hold the medication and notify the provider. B. Administer half the dose. C. Give dose anyway to control pain. D. Document the respiratory rate only. Answer. A. Hold the medication and notify the provider. Rationale. Respiratory rate less than 10 indicates respiratory depression risk. Holding medication prevents further compromise. Question 36. A nurse sees an unlicensed staff member silencing an IV pump alarm without assessing the patient. What should the nurse do first? A. Report the staff member immediately. B. Reassess the patient and correct the pump issue. C. Ignore it because the alarm is silenced. D. Reassign the pump to another nurse. Answer. B. Reassess the patient and correct the pump issue. Rationale. Patient assessment is always the priority. Reporting A. May follow but does not address immediate safety. Question 37. A patient with C. difficile is requesting assistance to the bathroom. Which infection control practice is correct? A. Use alcohol sanitizer only. B. Wear gloves and gown before providing assistance. C. Wear N95 respirator. D. Use goggles only. Answer. B. Wear gloves and gown before providing assistance. Rationale. C. Diff requires contact precautions. Alcohol sanitizer A. is ineffective. N95 C. Not needed. Goggles alone D. Insufficient. Question 38. A medication drawer contains 2 vials labeled with similar names and similar packaging. What is the safest nursing action? A. Administer based on memory of vial shape. B. Separate, label clearly, and double-check with another nurse. C. Use whichever vial is more full. D. Skip double-check, since both are safe medications. Answer. B. Separate, label clearly, and double-check with another nurse. Rationale. Prevents look-alike or sound-alike medication errors. Question 39. A patient complains of severe pain, but the PCA pump shows no doses delivered in the past hour. What should the nurse do first? A. Tell the patient to push the button harder. B. Assess pump function, patient technique, and IV patency. C. Increase basal rate without order. D. Disable the lockout feature. Answer. B. Assess pump function, patient technique, and for patency. Rationale. Safety assessment is required to determine cause, pump failure, infiltration, misuse. Unauthorized changes, C.D., are unsafe. Question 40. The nurse is implementing strategies to prevent medication errors on the unit. Which actions demonstrate safe medication practice? Select all that apply. A. Using two patient identifiers before every medication administration. B. Preparing medications for multiple patients at the same time for efficiency. C. Clarifying any unclear or incomplete prescriptions with the provider. D. Documenting medication administration immediately after giving the dose. Answer A. C. D. Rationale. A. Ensures correct patient safety. C. Prevents prescription errors. D. Reduces omission and duplication errors. Preparing meds for multiple patients. B. Increases the risk of mix-ups and is unsafe. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.